So now I would like us to move to the first technical session for today, which is going to focus on air quality and health impacts of air pollution in the region. And we have a series of very excellent speakers. But before that, I'm sorry, my laptop is not behaving very well, it seems, but I would like to welcome now Ms. Hristina Vojvodic, who is a legal expert in energy and environmental law. She currently works at RERI in Serbia and has expertise in implementation and application of legal protection laws in the field of air protection. So again, Hristina, a very warm welcome to you and thank you for taking the time to join us. Over to you.
Thank you, Pallavi. Good afternoon from my side as well. I would also like to welcome all the participants to today's session and to thank the organizers for gathering recognized experts in the field who will actually help us better understand the correlation between current air quality and health risks in Southeast Europe. And without further ado, it is my great pleasure to introduce our first speaker, Mr. Alberto González Ortiz, coming from European Environment Agency. Mr. Ortiz has worked as an air quality expert at the European Environment Agency since 2011, and he works on air quality measurements, management, and health impacts. He is the one responsible for the Air Quality in Europe report, a report that most of us quote and analyze throughout the year. And he also serves on the European Commission's expert group on the ambient air quality directives and the European Forum for Air Quality Modeling. Prior to joining EEA, Mr. Ortiz served as the head of unit of air quality at the Ministry of Environment in Spain. Welcome, Mr. Ortiz, the floor is yours.
Alberto, we cannot hear you.
Still, we cannot hear.
Okay, sorry, maybe I was...
Now it's perfect.
I was mute. Yeah, I mean, these things happen, as Pallavi said, after 1 year of this kind of meeting still. We have things to learn. So I will start sharing my presentation again. So I hope now you can see my presentation and hear me.
Loud and clear.
Okay, thank you. Thank you very much. I just started saying that I thank you for the nice introduction and also the organizers of this event for giving the European Environment Agency the opportunity to present our work on air pollution and also to highlight this important issue for the Southeast European region. So I will provide you with an overview of the situation of air pollution in Europe with a specific focus on the Southeast European countries. And most of the facts that I will present comes from our Air Quality in Europe report, which is an annual report published by the European Environment Agency back in, since 2011. So last year we pollished our 10th edition, and we provide here an overview of the situation in Europe, focusing on air pollutant emissions, but mainly on air pollutant concentrations and also the impacts on environment and on health. We are very proud of this report, which gets a lot of attention from public and the media. Is one of our bestsellers actually, And I'm also very happy to see that some of the previous speakers have used already part of the information in this report. So focusing on the status of air quality in Europe, I will present you information in form of maps. So what you will see here is the concentrations measured at different monitoring stations across Europe and reported to the European Environment Agency. So it could be the case that in some countries there are more stations available, but of course I can only present the information that has been reported to the agency. And for that we also consider that the stations reported have to have a minimum number of valid data, which in most cases is 75% of all the possible measurements. So here you have the situation for fine particles. So each dot in the map represents the monitoring station, and the color is in relation to the concentrations. So red and dark red dots represent stations with concentrations above the European Union limit value, while dark green color stations represent concentrations below the World Health Organization air quality guidelines. So just to remind you, the limit value is 25 and the air quality guideline is 10. So you can see here that the highest values are measured in Eastern Europe and Northern Italy, and specifically in the Southeast European countries, even if we have some countries not reporting data for PM2.5. And that is why I also present the situation for PM10, of which PM2.5 is a subset. Here you can see that we have more stations all over Europe and also more of the Southeast European countries covered. And again, we see that the highest concentrations happen in all Eastern Europe, Northern Italy, and specifically in the area of Southeast Europe. And this is due, we will see it also later, this is due to the emissions coming from the domestic heating. We have heard this also in the previous presentation. So mainly the combustion of solid fuels like coal or wood to heat homes. If we have a look at the specific situation in countries, here you have for each of the countries a summary of all the reported stations with the minimum value reported, the maximum, the average, and then the percentiles 25 and 75. So this means that 25% of all the stations in a country have values below this concentration, 25% have values above this concentration. This is the average, minimum, and maximum. And we can see again here that most of the Southeast European countries that reported concentrations are in the right side. That means that in the highest concentrations. And you see, for instance, here that Montenegro has all the 3 stations with concentrations above the daily limit value, which is represented by this red line. Moving to another pollutant of concern, which is benzopyrene, which is a carcinogenic pollutant, and that is also coming mainly from the combustion for residential heating. We see again, in spite of lacking data from many of the countries in the region, that the highest concentrations are again in Eastern Europe and Northern Italy. And now I would like to present you the situation for nitrogen dioxide, which is a pollutant that comes mainly from traffic. So here again, we see that the red and dark red dots represent concentrations above the annual limit value of the European Union and the air quality guideline set by the World Health Organization, that it is, in this case, are the same, has the same value set at 40 micrograms per cubic meter. In this case, we see that these red dots spread all around across Europe. So in this case, the stations are mainly located in big cities with high population density and also cities that are highly trafficked. But we can see also that in the region of interest, mainly in Romania and Serbia, we have stations above this limit value. And finally, I present here the situation for sulfur dioxide. I present here the annual mean, which is not related to any specific European standard, but it's to provide an overview of the situation. And again, we see that the highest concentrations are found in the Southeast region. And specifically in 2008, we also saw exceedances of both the daily limit value and the hourly limit value in Bosnia and Herzegovina, Bulgaria, and Serbia. So now a bit of good news. In last year, European Air Quality in Europe report, we presented a trend analysis study. So we analyzed the situation in the past 10 years. So the years covered by the 10 editions of the Air Quality report. And you see here for all Europe, this is an aggregation, and the average of the measured concentrations of PM10 per station type. And we can see a decrease in all kinds of stations. And if we have a look at the specific stations, we see that the significant trends are in most cases decreasing trends, and they can reach up to 2 micrograms per cubic meter per year, as we can see in some of the Southeast European countries. You can find more information at country level, all information that is available in this country pollution fact sheets on our webpage. And now I will move to analyze the sources of these pollutants. So where are these pollutants coming from? And here you have the main pollutants that are considered in the European legislation. And here you have the contribution of each specific sectors that are named here. So as we were saying, for particulate matter, the main sector is residential, commercial, and institutional. So again, this is the combustion of fuels to heat our households or our shops or our buildings in general. As I was also saying before, for nitrogen oxides, we have as main source the road transport, but also the non-road transport. And in the case of particulate matter, we have like the second contribution comes from industry. I would like to highlight that this is the aggregation of all the emissions at European Union level. So there are some countries that don't have a detailed information when it comes to these national emission inventories. And this is a very important source of information because it tells us where the pollutants are coming from, and so where we need to act to reduce the air pollution. So moving a step forward, once we have the air pollution, we need to see how this impacts population. And first, we need to know which is the exposure of population to air pollution. And what I present here is again an aggregation for all Europe of the situation. The exposure is presented as population-weighted concentrations for the two fractions of particulate matter, PM2.5, PM10. And we can see that through the years, we see a decrease on this exposure, again, as I said, as a European level. And here I have the situation at urban environments and only for the EU 2028. So we have seen in previous presentation this information. This is only to highlight the difference between the European limit or target values and the World Health Organization guidelines. But since it has already been discussed, and for the sake of time, I will skip this. And now I will focus on the next step, which is to calculate these impacts of air pollution. And we have heard that air pollution impacts in several ways, causing a long range of diseases. But what we do at the agencies estimate the mortality due to exposure to PM2.5, ozone, and NO2. And for doing that, we use a methodology that can be found described in these three reports. But basically, what we do is we follow the recommendations in the World Health Organization's report from 2013, the HAPI report, when we use the concentration response function recommended there. And for instance, for PM2.5, we consider the whole range of concentrations. So this, together with the fact that we use a specific concentration map that comes from the measurement stations that I presented in the previous map, but also interpolated using the results of modeling and some other variables, like for instance, meteorological variables. With this, we obtain some results that in some cases are different to other estimates, as for instance, the global burden of disease. So coming to the specific results we found in last year's report for 2018 and for PM2.5, we see that for the European Union, we found that 379,000 deaths are attributed to exposure to long-term concentrations of PM 2.5. And in the case of all the European countries considered, this number raises up to 417,000. If we look at how these deaths are distributed in Europe, and for that I have standardized the numbers, in this case the years of life loss, not the number of premature deaths. So we can see that the darkest colors corresponding to the highest impact happen in Eastern Europe and specifically in Southeast Europe. And of course, this is aligned with the highest concentrations we have observed. And again, I would like to give here some good news. In our case, contrary to the previous presentations, we have found that in the last 10 years considered, so from 2009 to 2018, the number of premature deaths attributed to exposure to PM 2.5 have been reduced by 13%. That still, it's far away from the 55% that is the ambition under the Zero Pollution Action Plan. And I would like to finish presenting something that has been also highlighted in previous presentation, and it's these inequalities when it comes to exposure of pollution. So for that, you have here at the NATS3 level, so this is the regional level, you have the number of premature deaths standardized by inhabitants, and in the map below you have the gross domestic product also at NATS3 level. So in the first case, the darker the region, the higher the number of mortality. And in this case, the darker the region, the lower the income, so the poorer the region. And we can see that in both cases, I mean, the higher concentrations and the lower income happens in the Southeast European region, and we can see it overlapping the two layers. It's more evident that we have this spatial coincidence of high air pollution and lower incomes. So to summarize, to wrap up, we see in the Southeast European region some of the highest concentrations for many of the pollutants considered in the European legislation. And this is due mainly to the emissions coming from the combustion of solid fuels, as mentioned before, such as coal or wood, for heating the households, but also for industry. This origins that the number of premature deaths, the mortality rates are also the highest in this region, are the highest in Europe. But nevertheless, the situation has improved, and this is so because the measures implemented to reduce the emissions and to improve the air quality has been efficient. So measures taken at European level, at national, regional, and local level. And of course, we have to go on implementing the right measures to go on with the improvement. And one aspect that we have to bear in mind when implementing these measures is the right transition, the just transition, to take into account regions where maybe energy poverty is higher, because as we have been seeing in general, the more deprived people are exposed to higher levels of air pollution. And with that, I would like to conclude. I'm very happy to take any of your questions in the Q&A sessions. And of course, you can also contact me at the email address that you have here after the workshop. Thanks.
Thank you very much indeed, Mr. Ortiz, for that absolutely excellent overview of the current regional air quality trends. It seems like a very crucial time to talk on the topic, and I am sure that we will see a lot of questions related to the important points that you raised in your presentation. And I personally believe that it is really important that you mentioned the importance of the national inventories, as well as taking into consideration inequalities in just transition. Now I am pleased to welcome Dr. Elizabet Paunovic, a very special guest from Serbia, who will be sharing with us her expert opinion on the health impacts of air pollution in Southeast Europe. Dr. Paunovic is a medical doctor and an expert in public health with a focus on environmental and occupational health. She has worked in the field for more than 40 years. During her long career, she has participated in numerous projects related to occupational and environmental impacts on health. Prior to joining WHO, Dr. Paunovic served in several high-level positions in Serbia. At WHO, Dr. Paunovic served as the program manager for environmental exposures and risks, and the head of WHO European Center for Environment and Health. She retired in 2018 and is now engaged as a freelance expert in the area of environmental and occupational health. Welcome, Dr. Paunovic. We are looking forward to your presentation.
Thank you very much, Madam Chair. Can you hear me?
Perfectly.
Okay, thank you, and good afternoon, ladies and gentlemen, dear colleagues. I would like to ask colleagues to share my first slide. Thank you. In the previous presentation, you have seen the levels of ambient air pollution in Europe, and especially in Southeastern Europe, and the health impacts. And it is clear that the levels of pollution in SCE are high and health consequences are unfortunately grave. To put this data in a wider social and developmental context, we can ask ourselves, what are the common denominators for these countries causing such situation? And of course, some of these common situations were also mentioned so far. So there are common challenge of primarily relying on use of the coal in energy sector, from power plants to home use for heating and cooking, and having an old car fleet, for example, to mention only some of them. And there is also a common challenge in SE countries that health consequences of air pollution are still not a priority in core health agendas. So many health policymakers and even practitioners still do not know what diseases air pollution causes or how severe those can be. Countries in SCE are sharing also the same paradox that although the scientific research and data related to the impacts of air quality, and we have heard a lot of such data so far, to human health are paramount, but the policy response and the uptake and impact of this data on policy making and implementation is low. In this slide, we can see that according to global burden of disease, ranking of risk factors by total number of deaths from all causes, for all ages, and for both sexes, air pollution is ranked as the 4th largest risk factor, and after high blood pressure, exposure to tobacco smoke, and dietary risks. And that was mentioned so far, but I have decided to start my presentation with this extremely important fact. Next slide, please. There is one more shared common characteristic of the most SE countries, which is also important in the context of impacts of air pollution on health, which was mentioned several times so far, and I'm mentioning this one again. The countries mostly belong to low and middle income countries, and we can see in this slide WHO data on age standardized deaths per 100,000 capita, but attributed to air pollution, but by the groups of the countries in WHO regions, and the countries are grouped according to income. And we can see that the death rates caused by air pollution in low and middle income countries in all WHO regions, including European region, marked here by the arrows, are much higher than in high income countries. And it relates both to the death rates caused by ambient air pollution, which is here presented in blue, and household air pollution presented in red. And for household air pollution, unfortunately, this disparity is extremely high. It's 4.7, almost 5 times higher, according to WHO data, in low and middle income countries in WHO European region. So to say it with the simple words, high levels of air pollution are linked with poverty. Next slide, please. According to the publication Core Health Indicators in WHO European Region 2020 with a special focus 2030 Sustainable Development Agenda, we can see that the mortality attributable to household and ambient air pollution per 100,000 is high in most of SE countries, is twice as high, and in some countries even higher than it is the average for WHO European region. So when we are discussing the availability of health data in relation to that, I would like to make some relevant remarks about the whole region. Health data that are used in health risk assessment attributed to air pollution and paired with air quality monitoring data, to mention some of them. For example, baseline rates of health outcomes caused by air pollution or mortality data. They are available at the national levels, and all the countries are reporting them to WHO Health for All database. It is also important to be aware that health data availability, but also at quality, at subnational level is a subject to different in-country approaches. So it is hard to draw any general conclusion, but for morbidity data, there is a lower reliability in general, as the Health for All database uses hospital discharges as the indicator for some diagnosis, which is then not providing quite an accurate picture. And for some diagnoses, population-based registers can be used, registering the number of new cases, which is of higher reliability. And in this context, for example, number of new cases of lung cancer could be relevant and available. So data from national cancer registers at the national levels in the countries in Southeastern Europe can be used for this purpose. And we have to be also aware that the countries in Southeastern Europe are small, so they are not having sub-national country registers. Next slide, please. This slide and the next one are presenting findings from the UNEP study, Air Pollution and Human Health, the case of the Western Balkans. Unfortunately, in this region, and it was already mentioned in the previous presentations, there is not much of such research performed to analyze local situations, either with the groups of countries or at national or subnational levels. So this study is for now the only inter-country analysis, taking into account some of the countries in SCE, namely Albania, Bosnia and Herzegovina, Montenegro, North Macedonia and Serbia. So here we have the cities from these 5 countries and the data for PM2.5 concentrations in these cities. Annual concentrations of PM2.5, we can say that in all of the selected Western Balkan cities, with the exception of Vlore, Albania, exceeds the WHO air quality guideline value of 10 micrograms per cubic meter, and the majority of these cities, 75% of them, even exceed the less stringent European Union limit value of 25. You can see these 2 lines, blue line, WHO limit value, recommended limit value for PM2.5, and in red, EU. Next slide, please. This mentioned study already also analyzed the specific cause mortality data for some of the cities. And we can see that the absolute number of deaths due to specific causes, stroke, ischemic heart disease, chronic obstructive pulmonary disease, lung cancer, as well as the cause-specific mortality rates attributable to PM2.5 exposure were calculated. here. So we can also mention that for all 5 countries considered in this study, the WHO estimates attribute around 13,640 deaths to PM2.5 exposure, of which about 4,500 or some 35% are attributable to PM2.5 concentrations that exceed the air quality guidelines limit values. Next slide, please.
Sorry, I need to ask to wrap up in another 1 minute, please.
Yes,
Thank you.
In fact, last slide. So it was already mentioned that the air pollution in low and middle income countries is higher, but it should be stressed out that also grave health consequences of polluted air are causing significant economic loss. And in 2015, WHO Regional Office for Europe and OECD estimated annual economic costs of health consequences of air pollution. And in some of the Southeastern European countries, for example, Serbia, Bulgaria, Bosnia and Herzegovina, it reaches even up to 1/3 of GDP. So we have to be aware that there are also costs of inaction, not only costs of action that are quite often mentioned in this region when we are talking about interventions to tackle air pollution. And the last slide, please. From this snapshot of the situation related to the health and economic impacts of air pollution in SE, it is clear that only the approach that takes into account sustainability and measures in all 3 pillars of sustainable development can be the right and the only way to tackle air pollution, meaning social, health and well-being, economic and environmental. And in these 3 SDG goals are the targets that are directly linked with the commitments to improve air quality and decrease related premature mortality by 2030. And policy making for health across sectors becomes a crucial factor that will need to be addressed in building better systems for health and well-being in Southeastern European countries. And with the last slide, please, I would like to thank you all for your kind attention.
Thank you. Thank you, Dr. Paunovic, for the excellent presentation. And thank you for reminding us that the decrease of the premature mortality caused by air pollution is not some abstract concept, but rather concrete obligation that our governments have undertaken. So I'm using this opportunity to remind you to please feel free to use the chat function, and we will be happy to have a rich discussion. So I turn out to our next speaker, Dr. Uros Rakic from Public Health Institute of Serbia, Dr. Milan Ivanovic Batut, who will present to us health impacts of ambient air pollution in the Republic of Serbia. Dr. Rakic has worked on several projects focused on air pollution and health in Serbia. He is also a member of several government working groups, including the Ministry of Environmental Protection of the Republic of Serbia Working Group for the Air Pollution Reduction. He has a PhD in Public Health Management and Masters in Geographic Information Systems. Welcome, Dr. Rakic, the floor is yours.
Thank you very much, Hristina. Good morning and good afternoon, everyone. Sorry. Do you see the PowerPoint presentation? Hello?
Yes, yes, everything is right.
Okay. The Serbian Environmental Protection Agency set the first station for automatic air quality monitoring at the end of 2006 in Smederevo and Bor. The main impulse to the establishment of the National Automatic Air Quality Monitoring in the Republic of Serbia was given by the European Union project IPA 2012. This project has donated equipment for 28 measuring station, calibration laboratory, analytical laboratory, and a mobile station. Air quality in the Republic of Serbia is regulated by existing domestic legislation. The basic law is the law on air protection. The Serbian National Network of Automatic Stations for Air Quality comprises 61 stations. You can see the web site of Serbian Environmental Protection Agency, and in real time you can see all data from 61 monitoring stations. The monitoring station collects measurements of PM10, PM2.5, NO2, SO2, ozone, and other pollutants such as carbon monoxide, and the results are publicly available in real time. We have around 180 measuring points in the local Institute of Public Health networks and local government municipality. In January, the government of the Republic of Serbia formed a working group for systematic solution of air protection issue and appointed the Prime Minister as the president of that body. The task of the group is to monitor, analyze, and discuss the most important issue in the field of air pollution in Serbia. The group will coordinate to the work of all state and other competent authorities and institutes and will propose and analyze the effect of measurements taken by competent authorities to protect and improve air quality. Very important draft for air protection program in Republic of Serbia. We had the first conference on preparing the draft of the air protection program in the Republic of Serbia with combining action plan in April 2021. The draft of the air protection program in the Republic of Serbia with an action plan will define air quality goals and measures for the achievement thereof, and it will provide the basis for future development and adoption of bylaws and continued implementation of European legislation. You can see in the local government that have adopted on air quality plan 6 cities: city of Belgrade, Bor, Novi Sad, Pančevo, Smederevo, Užice. City of Valjevo have air quality plan, but it's on a correction to the request of the Ministry of Environmental Protection in progress. We have in 7 local governments the short-term plan, and 5 local governments with the obligation to prepare and adopt city of the Niš, city Kraljevo, city Subotica, Sremska Mitrovica, and Kragujevac. You can see from the right side, you can see we have the first sky cleaner, which was installed at city of the Belgrade on the occasion of World Environmental Day this month. This device is produced in the Serbia and can purify up to 180,000 cubic meters of the air. The City Institute for Public Health Belgrade will measure the air quality in the area covered by the sky cleaner to demonstrate its efficiency. From the left side, you can see we have all information about air quality in cities. From the right side, this is the main page of newspaper online. You can see air quality index. The Serbian National Network of Automatic Station have in 2021, we now have 30 automatic air quality monitoring station measuring PM.5. In 2019, we have 20. The main source of outdoor air pollution in Serbia include the energy sector, thermal power plants, district heating plants, individual household heating, the transport sector, and all vehicle fleet, waste dump sites, and industrial activities, all reference the chemical industry, mining and metal processing, and the construction industry. We have a big impact of household heating in cities. We have a very problem because almost in every city we have the problem with PM10 and PM2.5 in cities because we have a lot of household heating in peri-urban and rural towns and in all other cities in the Serbia. Other problem is not only dust industrial or activities of industry. We have in some part of the year we have a problem with the Sahara dust, coal spike in the European air pollution. And in last 2 years, we have in 2 episodes with problem with dust from Asia in Europe in October 2019 and March 2020. PM suspended particles were in 2019, as in previous years, the dominant pollutant in the Republic of the Serbia. Exceedance of the daily limit values of 50 microgram per meter cubic during the 2019 was at all measuring point, and their number from 6 days to the 169 days. All others, NO2, we have problem in the city of the Belgrade on fuel location. SO2 problem we have in the city of the Bor. You can see on this slide. Very important for energy systems that the members of the National Assembly of the Republic of the Serbia adopted 4 laws in the field of mining and energy at April 2021, including 2 new laws, the law on the use of renewable energy source and the law on energy efficiency and rational use of energy, as well as amendments, the 2 laws, the law on energy and the law on mining and geological research. Serbia would adopt a national plan on the energy sector and climate, and the government is embarking on a completely different energy policy after also adopting 4 new mining and energy laws. A draft integrated national energy and climate plan for 2021 to 2030 with a vision until 2050 will be developed as a part of the 40 capacity development for energy planning project. The plan will define the goals regarding boosting the energy efficiency as well as regarding renewables and reduction of greenhouse emission until 2030. The plan will also set forth policy and measures aimed at achieving those objectives in line with Serbia's commitment to the greener and cleaner energy sector. This does not mean that Serbia will immediately shut down the thermal power plants, but Serbia will do everything to reduce emission to minimum. Serbia started the construction of their desulfurization facility, a thermal power plant, and this project it's hoped to end in 2024. You can see on this slide annual data for 20 stations from time period 2013 to 2019. You can see for PM 2.5, almost every year, every station will have more than 25, the limit value for PM 2.5. This is data for 22 city town. You can see the average value for PM 10. You can see almost every city every year have a problem with average for PM10 limit. Only the green color is less than 40 by the year. This is for every city and town. This is average from 1 to 8 station in the city. It's creating a model, and you can see from the right side, you can see PM 2.5 average concentration.
Sorry, Uros, I will need to ask you to wrap up in another 1 minute, please.
Okay. This is the number of average days per year with PM10 more than 50. You can see every year only 4 days we don't have a problem. This is a slide you can see for the 4 cities. Only problem is for air pollution in winter time period. January, February, March, October, November, December is the good situation in the Belgrade. We have in last 2 years very good situation for PM10. This is indicator fixed measuring the level of pollutants from mobile source of air pollution in Belgrade. This is a calculation estimates a premature death for mortality data 2019, you can see we have now 8,700 premature death. For Serbia, this is a long-term mortality due at PM2.5, cut off 10 in 22 Serbian cities. This is a scenario when we reduce by 5, 10, and 20 microgram per meter. For the year of life lost, the same scenario. You can see on these slides, and I finish my presentation. This is very complex problem, air quality, not in Serbia, not in Western Balkan, in the whole world. You can see, this is from left side, you can see European country. They have a problem, and the European Commission issuing to letter of formal notice, which define the scope of the case. If the Commission does not consider member states' arguments to be reasonable and convincing, send another letter. Then if the problem maybe go to European Court of Justice. This is, we can see, all these countries work on the reduce air pollution 30, 40, 50 years. Serbia work to reduce pollution, but we can see it's a marathon. It's a very challenge and complex problem to work. You must work every year. It's not end if you adopt papers or something. You must work on local level and from all countries and all other countries. Thank you very much.
Thank you, Dr. Rakic, for your presentation. That was great. That was great that you can give us the comprehensive data on the air quality in Serbia. Now I would like to introduce the last speaker for today's session, Dr. Angel Dzhambov. Dr. Dzhambov is a medically trained doctor with postgraduate qualifications in preventative medicine and mental health. He currently works as a senior assistant professor of hygiene at the Medical University of Plovdiv in Bulgaria. His research interests span environmental and occupational epidemiology, environmental psychology, and application of systematic review and meta-analysis methodology, with a focus on health effects of natural outdoor environments, environmental noise, and air pollution. In addition, he received the ISEE Rebecca James Baker Award in 2017. Welcome, Dr. Dzhambov. We are very excited for your presentation.
Thank you, Hristina, for introducing me. I hope you can all see my slides.
Yes,
screen.
perfectly.
Okay, great. And thanks to the organizers for having me today. So I think my talk will nicely connect to what was said earlier. So I will only touch upon the exposure issues and exposure inventories, as well as socioeconomic burden of disease attributable to air pollution. And mostly I would like to focus on an important point that was raised earlier by Zorana in her presentation about the key role that local epidemiological evidence plays in setting environmental policy and informing stakeholders. So to put in context that, I would like to direct your attention to the most recent data on public opinions and attitudes toward air pollution in the country. This is the latest data from the pre-COVID time, late 2019. You can check out the report at the Eurobarometer website. So what's striking here is that compared to the average for the EU, Bulgarians of all socioeconomic strata report much lower awareness and much less, they possess much less information on all matters related to air quality, which is one of the caveats that undermines effective air quality management in the country. But at the same time, and this is also a very consistent percentage across socioeconomic and demographic strata, Bulgarians feel that over the past decade or so, air quality in the country has actually worsened compared with what most Europeans report. So how does that compare to objective data from emission inventories? So in 2020, the European Clean Air Center published a very extensive overview that drew on official data reported by the Bulgarian Environment Agency. And what's interesting here is that while the same trends and patterns that are seen in Serbia and other neighboring countries are replicated, that is, we have high contribution of domestic heating to emissions of specifically particulate matter and benzpyrene, and relatively lower contribution of NO2 to global emissions. The availability of exposure data is insufficient in order to draw firm conclusions on that. As most of you probably know, a few years ago, there was legal proceeding, infringement proceeding against the country that was brought before the European Court of Justice, specifically because of the exceedances in PM10 emission levels in multiple monitoring sites, specifically in the city of Plovdiv, which ranks second in terms of socioeconomic costs attributable to PM10 in Europe. However, one of the reasons for that was that we have much richer data on PM10 compared with other pollutants like PM2.5, which from a health perspective should have a stronger impact on health. So looking at official data from monitoring stations and exceedances over the past 5 years, at face value, it appears that exposure levels are decreasing, and that's certainly a trend. However, we should take that with a grain of salt, because as you can see from the 50-something monitoring sites that we have in the country, PM2.5, which, as I said, is a pollutant that should be of keen interest, is only monitored regularly at 10 stations. And even those 10 stations are not exclusively positioned in major city centers. So on top of that, we had malfunctions in some of the stations that actually monitor PM2.5. So the availability of data is even more limited. So generalizing these trends and being overly content with how our environmental policy is handling the air quality issue is not advised. We need a much more rich set of exposure inventories at a finer spatial resolution, which also, the lack of that also hinders research in the area. So in terms of monetary costs, because I find that stakeholders understand this metric most and can relate to it and comprehend the real magnitude and dimensions of the issue in the country, you see that the total damage costs in terms of both direct and indirect costs that have been monetized and that can be attributed to air pollution. And mind you, usually these estimates are calculated under conservative assumptions, so they probably exceed these levels, are striking. So over 200, even over 300 million euros lost in 2018 in these Bulgarian cities. And I have not presented here how Bulgarian cities rank compared with other European major agglomerations, but just a hint, I already mentioned Plovdiv ranks second in terms of PM10 associated costs in Europe. The city of Ruše, as you can see, it's in the northern part of the country, close to the Romanian border. it actually ranks first in terms of costs as a percentage of the GDP, the gross domestic product of that the respective city. So these statistics are striking, and they come to show that investment of resources in managing air quality will ultimately prove to be cheaper in the long run than just sitting back and doing nothing. Now, specifically, I would like to review some of the recent evidence, the most prominent papers published by Bulgarian authors, and that report local evidence on adverse health effects of air pollution. They have been grouped by age group, and I've focused on the period since the year 2000, outlining some of the seminal works that give us a feel of the characteristics of epidemiological research that's going on in the country. So earlier studies by a colleague of ours, Ternovska et al., they were done in children, and they quite ingeniously used official air quality monitoring data across settlements and also temporal changes in air quality in the form of a natural experiment. When Bulgaria transitioned to market economy, and that effectively reduced air pollution levels in some regions as major enterprises and factories were shut down. And what they found was that children whose schools were located in highly polluted areas, or who lived in a city where pollution levels were higher, or who had experienced higher pollution levels in their early life, or during or in the prenatal period, so their mothers had lived in such an area, they, as at school age, they had considerably worse lung function parameters as measured by spirometry, and also treadmill tests supported adverse effects of air pollution on cardiovascular and cardiopulmonary function. Effects on the immune system were not so pronounced, but still some differences were noted in the blood count parameters of those children. In adolescents, there was a study in the city of Stara Zagora, which tends to be one of the most polluted areas in the country, is located close to major coal power plants. So the authors went beyond respiratory outcomes and looked at the balance between pro and anti-inflammatory cytokines in those adolescents. And they found an altered balance in that city compared with other settlements where pollution levels were lower. A study of ours took a slightly different perspective. We recently looked at health effects of mental health effects of air pollution, hypothesizing that adolescent students living in more polluted areas would feel constrained in their outdoor experiences, specifically physical activity, as the environment would not be so conducive to engagement in outdoor activities. And indeed, it turned out that
Dr. Dzhambov,
yes.
I will need to ask you to wrap up in another 1 minute, if possible.
Okay, maybe not a minute, but bear with me, I'm near the end.
Thanks.
So indeed, we found adverse effects on mental health. Studies in adults focused on various outcomes. So 3 of them were part of an international project with Slovakia and Czech Republic, and they actually used personal monitors to assess air quality and linked PAHs and benzpyrene, strong carcinogens, to DNA damage and potential carcinogenicity in participants. And these effects are most pronounced in Sofia compared with the other participating cities. Time series studies found correlations between daily and monthly air quality and hospitalizations for cardiovascular disease or other chronic diseases in the cities of Varna and Stara Zagora. And in Plovdiv, a study of ours found, albeit non-significant, associations between PM2.5 and benzpyrene with diabetes prevalence. And lastly, studies in vulnerable populations, like patients with pre-existing disease, like COPD, so chronic obstructive pulmonary disease, found higher risk of higher rate of hospitalizations on days when air pollution levels were greater. And in another study, we found a multiplicative interaction between noise and air quality, with high noise exposure being adversely related to renal function in CVD patients only when air pollution levels were high. So general conclusions that we can draw are there are some promising patterns, some promising trends in these studies. So the scope of research has been expanded beyond respiratory outcomes, which I find very encouraging, tackling cardiovascular, metabolic, immune parameters and outcomes. We've also focused on both short and long-term effects of air pollution, made use of various designs like national experiments, and also went beyond using air quality monitoring station data by drawing data from monitors, personal monitors, dosimeters, and land use regression models. Also, there has been a focus on vulnerable populations like patients and children. However, there are some caveats that, in my opinion, thwart or impede rapid progress in the field. So in the exposure assessment domain, over-reliance on air quality monitoring station data limits the spatial granularity in exposure data. So we cannot look at fine spatial patterns of association between air quality and health. These stations are too sparsely distributed to provide a good coverage of major cities. We don't have high quality land use regression models to model exposure estimates. In terms of research designs, sample sizes have been smallish, non-population based, which has made impossible deriving those response functions, which are needed for valid estimates of local burden of disease, that will be applicable to the Bulgarian population. Statistics-wise, we can also note that especially time series studies have used kind of rudimentary designs, like simply correlating daily incidence or mortality with daily concentrations of air pollutant without modeling dynamic regression curves. And models rarely control for major confounding factors. So it is very difficult to interpret findings sometimes and disentangle effects of air pollution from other contextual factors. And lastly, I believe that is due mostly to poor communication between scientists that are concerned with various aspects of air quality, between clinicians who are not necessarily well versed in exposure assessment people who are not necessarily that knowledgeable of health impacts, and mosaic work without a truly transdisciplinary approach, which I believe can be overcome in time. And these conclusions, last slide, were largely confirmed by the report of the European Clean Air Center. So the deficiency of adequate and thorough exposure inventories, the inaccessibility of data for researchers so that they can assign exposure estimates to their participants in an easy fashion. Other issues related to management of air quality had legal routes, insufficient funding in this field, insufficient capacity, and just a few seconds, and poor communication, as I said, between various stakeholders concerned with air quality. Thank you.
Thank you, Dr. Dzhambov, for the excellent presentation and for giving us the sense of what the challenges are in Bulgaria, as well as providing to us some concrete recommendations how to improve the scientific research in the field, as well how to improve air quality management in general in Bulgaria. Now we are moving to today's Q&A part of the session, and I am pretty much aware that the Q&A box is extremely busy, and I believe that our panelists answered most of the questions. But I would like to address one question live, the question of, I believe, a wider interest that I believe that we all can relate in the region. It was directed to Professor Paunovic, and the others feel free to contribute as well. I would start by asking, what would you tell people who say air pollution is a problem in southeastern countries because they are poor and solutions are expensive, so we cannot do much?
I would say exactly what I presented here, and I would talk about the cost of inaction, because in fact, quite often we hear only the costs of actions. Oh, they're high investments, because the costs of life lost, or the quality of life, or premature death, of the costs, medical costs, or workability costs lost, and so on, they are dispersed over all society. They are hidden if we don't address them properly. So there is not only, if you want to talk about the costs, then it should be performed the analysis of cost of inaction and the cost of action compared, and we will see that only to go out from this circulus viciosus is only if we address it and invest in improvement of air quality. Otherwise, it's really like a circle that we will go around. Poor countries are becoming poorer because of high costs, medical costs, other costs, life lost, and so on. So I would say that we should address in a complex way and look at all the costs, not just pick up, okay, it's a huge investment.
Thank you. Does someone else want to add something or comment briefly on the topic?
Yeah, I would like to echo that. I completely agree. So politicians, stakeholders should be presented with clear evidence that inaction costs more than investing in air quality management. And this scientific evidence should be presented in a digestible way so that they can take up on the key messages.
Thank you. I believe that there is one question that you already answered, addressed to Alberto and Elizabeth, and that was the question: to what extent have time trends in the air pollution attributed deaths in Southeastern Europe been driven by demographic changes and or changes in non-air pollution related mortality rates? For example, factors unrelated to exposure. I believe that this is very important questions that need to be addressed here. So please, the floor is yours.
Yeah, I mean, if I can come, I already answered I said a written answer. Yeah, the thing is, we haven't done this kind of sensitivity analysis, let's say. So when we estimate the premature deaths for a year, we use all data for that year. So we use the mortality, the demographic, and the concentrations data for this year. Of course, we could do the same change in concentration. I mean, using the same demographic data for 1 year and then changing the concentrations. We haven't done this. But of course, yeah, I mean, I also pointed this, that there are some issues, as for instance, aging of population, or the change of population from urban areas, from rural areas to urban areas, that can have an impact.
I would also comment. I have replied, but maybe in more details. We would need in the region more in-depth analysis. As we all pointed out, there are not much studies that we could, because the question also related to over the time trends. So we have some snapshots. I also know that WHO estimates are using age standardized methodology, but it's a snapshot. We are not getting here, you know, the picture of the overall situation. And the whole region is facing, first of all, with the aging population, secondly, with the high level immigration of younger people over several decades. So we would need really to address this in an appropriate way.
Thank you, Dr. Paunovic and Mr. Ortiz. My apologies to everybody to whom we did not have time to answer the question. I see there are a few unanswered questions related to air pollution deriving from thermal power plants in Serbia. So I would ask Uros to answer in the Q&A box. And I would like to bring this session to a formal close by thanking the great speakers who provided very informative and I believe educational answers to the questions. Thank you for your participation as well, and have a great afternoon, and goodbye for now from Serbia. I'm going back to you, Pallavi. Thanks.